Okay, how is Miss Sisi?
Alright, this is Sisi. She's a 5-year-old female intact Yorkshire Terrier. She's here for an evaluation, recheck evaluation of MUE and her next side is our treatment. Mom says she's been doing well, has stopped her head bobbing since we increased back her
pred, yeah. It was within a couple of days that she stopped head bobbing, I think, based on stuff, and no recurrences, right?
No recurrences.
Okay.
Has been doing well. No relapses seen at the house.
Okay, and ambulating normally?
Yes.
For her? Hey, Sisi. Sis says, why have you taken me out here? Why are you making me use my feet? I am meant to be carried. Hey, Sisi. Want to go to the left a little more, or are you going to keep on turning to the right? Still very slight tendency to turn to the right. We can pick her up and we can put her on a leash and walk in her straight line inside too.
Sisi, do you know how to walk in?
We'll find out. Still wants to turn to the right, but no head bobbing, just slightly better. Okay, well she can go up, and we can start putting stuff in vet radar for her side as our treatment. I'll call Pivo and we'll talk to Mom. He has good ears. So Mr. Man Rocky is an 11-year-old male neutered poodle mix. Was traveling with his owners on the 4th. They were in a place with like tile. He slipped, splayed out, seemed uncomfortable after that. Initially they monitored, but then he continued to seem uncomfortable throughout the evening, so they went to an ER. We prescribed prednisone and gabapentin, along with he has chronic GI stuff, so he already is on Proviable and Metro. With medications, he has returned to normal behavior as far as they can observe at home. At the ER, sounds like he maybe had some mild proprioceptive deficits in the pelvic limbs. Unclear if they were able to localize his discomfort at the time. Unclear if we're resting at home. On examination today, he's largely neurologically appropriate, has very mild proprioceptive delays in the pelvic limbs, does better on the floor than he does on the table. He still replaces, it's just lower than in the front legs. I could not get any localizable pain from him. He's a little anticipatory around the neck, but I think that's just nervousness. When I actually deeply palpate, he's fine, and when I did range of motion of the head, he was totally fine as well. He has a history of MPL in the left. He's a bit of a stiff-legged gait when he walks, a little less stifle flexion, but nothing. He says, these people give the weirdest pets, and I'm not sure how I feel about it. So with the proprioceptive deficits, could be like a mild resolving T3, L3. Hard to say for sure if that's where the pain was originating from or not. Could have been a disc injury that's improving. Can't rule out something soft tissue as well as far as the cause of the pain. Out of no abundance of caution, it would be reasonable for them to do like a kennel rest protocol just in case it was a disc. Can taper the prednisone, can continue the gabapentin. I don't feel the need for any more meds since he's pretty comfy on it. As far as rest protocol, I think a 222 would be fine. And then I don't know that he needs formal rechecks as long as they continue to do well at home.
Yeah.
A win is a win.
A win is a win.
Is he like super sedate on the GABA or anything? He's good on the 15. Okay.
Yeah. Cool. Well, he can go back if we have all of his vitals.
Yes.
And I can talk to them.
Awesome.
Good news parade. I know, are we excited?
This is Mason, our 5-year-old male neutered Maltipoo, presenting for a post-operative recheck of non-ambulatory paraparesis.
Yeah, he's non-impera.
Secondary disc herniation at L3-4. He had surgery on the 19th of December. Since surgery, he's comfortable at home. He's strongly ambulatory. Finished all his meds and they're resting him.
Good job, Mason. So he's comfortable off all meds. They don't need any trazodone to help with rest. That's doing well.
They said he's not happy with being confined, but they're not like complaining too much about it.
Your incision looks good. They don't want to come off yet, so it's not going to fall off yet. You're nice and comfy. Good child. He had a left L3-L4 hemilaminectomy. Is almost exactly 3 weeks post-op. Is slaying at home. Doing well, so has been walking well at home, is comfortable, is not on any medications, remains comfortable off medications, remains appropriately kennel rested. So he's winning. His incision looks good today. He can graduate I'll talk to him about graduated rest. But he looks fantastic on examination today. So he's walking very strongly. I would say has some very subtle residual weakness and mild wobbliness. So it's mainly that he's more like messy with his gait than he is weak. So he kind of crosses over sometimes, especially when he wants to go fast. He'll convert to that bunny hopping gait. Will kind of turn really fast and slip, which is expected at this stage post-operatively. He looks a lot better than some dogs do at only 3 weeks after surgery. The fact that he's so comfortable, so mobile, so independent on his own, I expect he should continue to make improvements with time. So I would say the majority of their improvements, maybe like 80%, happen in usually the first 2 months after surgery. So we're not even to that halfway point of that first 2 months. And then they can continue to fine tune for about 6 months after surgery. The good news is he's already at the point where he's comfortable, he's independent, he's going to the bathroom on his own. So I'd say any improvements from here are a bonus. So essentially he gets to graduate today. He can even have a graduation ceremony because he wasn't walking and he's walking again. Of course, I'll have our nurses call and check in on him periodically as you graduate his activity. But of course, if you haven't heard from us and I have any concerns in between those calls, just give us a call.
1, 2, 3. There you go. Awesome. Perfect. Thank you.
Okay, so we have Tazzie. He's a 4-year-old male neutered French Bulldog. He developed some back pain around the 5th, so a couple of days ago. That progressed to mild weakness in the hind limbs. He was initially seen by us a couple of days ago. At that time, he was ambulatory. His owners elected medical management at that time. However, despite rest and medications, his symptoms did progress, and currently today he's dragging the pelvic limbs. He's paraplegic, meaning that he doesn't have any movement in the back legs, but fortunately he does have very strong feeling in his back feet, which is important as far as prognosis for many different conditions. On examination, he has evidence of a thoracolumbar myelopathy. What that means is he has evidence of dysfunction in his kind of mid to lower back area, so he's uncomfortable in the back. He has decreased spatial awareness in the hind limbs. Given his history, his symptoms, his breed, our primary concern would be a disc problem, so an extruded disc or intervertebral disc extrusion, but other causes are possible. So first step is that we're going to proceed with an MRI to diagnose the problem. If it is a disc problem, we would likely be proceeding with surgery. Tazzie. This is for Tazzie. These are his preoperative x-rays. Heart and lungs look good. Overall spinal conformation is good. Sometimes French Bulldogs can have some block or hemivertebra that's considered largely normal for them. He does have some food in his belly, which isn't surprising since he declined this afternoon. His owners probably didn't expect him to be here this afternoon, so he got some food. We'll just make sure he gets some GI medications to decrease the risk of pneumonia, since, you know, he is paraplegic, so I would consider this an emergency and I wouldn't wait to fast him longer. This one, so it'd be like a tiny